Good afternoon, everyone. Thank you all for joining this webinar today. I am Curie, a nephrologist from Korea. I have nothing to disclose, and I have been working with many NGOs in the transplantation listed here to promote deceased organ donation and transplantation in Korea and Asia. The number of organ transplantation increased continuously in Korea, and more than 4,000 transplantation was performed in 2020. This program started in 1969 with a living donor kidney transplantation, which followed by the first deceased donor kidney transplantation in 1979. Most of the transplanted patients have enjoyed not only the good quality of life, but also the economic benefit of organ transplantation, since the average cost of LDKT per each patient is just 1/4 of that of colon cancer. Because of previously mentioned and many other benefits of organ transplantation, leading hospitals established organ transplantation centers and had developed programs for organ procurement from deceased donors in their departments or centers. We called this organ procurement program a HOPO, a hospital-based OPO. However, waiting lists and waiting times grow longer and longer, and the death cases while waiting reached up to 5.8 patients per day, even with the competitive establishment of deceased organ transplantation programs in many hospitals. This means Korea has this number of people filling up the Jamsil baseball stadium is now on the waiting list, and this number of people filling up the Opera Theater of Seoul Art Center is dying each year while waiting. This situation has driven devastated patients into seeking illegal ways for organ transplantation. At the beginning, illegal organ transplantation started from a personal interaction between donor and recipient. Then it changed into underground organizations or crime syndicates mediated activities. And nowadays, those end-stage patients seek opportunities for overseas transplantation through web-based black markets. In 2008, leaders of Transplantation Society and the WHO proclaimed the Declaration of Istanbul. The Declaration of Istanbul requests each government for its national responsibility and global cooperation in protection from organ selling, in stopping organ trading, and completing national self-sufficiency. In 2010, the third global consultation on organ transplantation was held in Madrid. In this seminar, 3 categories of national responsibilities for self-sufficiency were defined. These 3 were increased organ availability, ensuring fairness, justice, and transparency, and preventing the need for transplantation. To accomplish these goals, 2 action plans were presented. These were, first, to establish a legislative and regulatory framework, and 2, to establish the National Transplantation Organization. Meanwhile, Korea has adopted organ transplantation law in 1999 and have established a national organ transplantation organization named KONOS. KONOS, the Korean Network for Organ Sharing, has been responsible for managing waiting lists, allocating organs produced from deceased donors, addressing coordination and policy implementation, and playing a major role in the regulation and evaluation of organ transplantation activities. When corners come to very strict regulatory surveillance in every transplantation process, the number of deceased organ donors decreased sharply. This event resulted in a rapid increase in case of overseas organ transplantation, and the main destiny country for this unethical activity was China. In this embarrassing situation, we carefully reviewed the WHO requirement, and we found that we needed to develop an efficient and principled OPO under the evidence basis of database, which in this context analysis, we revised organ transplantation law in 2010 to insert additional articles including the establishment of OPO, adoption of mandatory reporting of potential brain death donors, and the establishment of National Transplantation Registry. Of course, the most immediate task was the establishment of organ procurement organization. We came to a conclusion that we needed to build a national independent OPO, IOPO, since in comparison to HOPO, IOPO can activate organ procurement process in non-HOPO hospitals, and IOPO can maximize the use of donated organs. As a result, KODA, the Korean Organ and Tissue Donation Agency, was established in 2009. Our next step was implementing the mandated reporting of potential deceased donors because the reporting rate was a very low level of around 15% in major hospital units of ERs and ICUs. A call center system was launched at KODA to receive reports for 24 hours, and the Donation Improvement Program DIP was started using regular hospital attitude evaluations and medical record reviews. By applying these initiatives of legislation of organ transplantation law, establishing a national transplantation organization, establishing a national independent OPO, and adopting mandatory reporting of potential deceased donors, numbers of actual deceased donors increased markedly with decreasing number of overseas transplantation cases. Even with all this effort on promoting deceased organ donation program, PNP number of the actual deceased donors in Korea remained very, very low. In 2019, Korea was ranked 31st among 37 OECD countries. This suggested that we have cultural barriers, including Confucianism, which prohibits any mutilation of the body and the respect of family members in decision making. We are taking opt-in system for the final decision in deceased organ donation because Korea has been a family-oriented society. When we analyze the main causes of donation failure, the family refusal was listed as the most common reason. The KODA annual report also showed that family consent rate of only 33%, which brings a huge drop in the consent rate. And unfortunately, the consent rate is decreasing every year. It is not easy to make a final decision for organ donation when a family member was diagnosed as brain death in a hospital. To overcome the family refusal, we started My Family Should Know About My Wish campaign, simplified the family consent process to respect the donor's right and/or wish by legislation of the first person authorization, and we decided to promote the donation after cardiac death program. My Family Should Know About My Wish campaign provides communication skill with the family for new and old organ donor card holders like this video on the YouTube. First person authorization for consent is form of concept that every adult has a legally binding right to decide on disease organ donation before the death of oneself. Self-determination concept that adult individuals should be able to make their own decisions about donation of organs after their death is consistent with ethical principles behind other advanced directives. The first person authorization consent law is in the process of legislation in the Congress. This includes especially a guideline for a clear documentation using driver's license or health insurance cards, and honoring the authorization especially in case of withdrawal of life-sustaining treatment. In 2017, we experienced a sudden decline in the number of deceased donors. Introduction of law on withdrawing life-sustaining treatment, negative media report on post-donation care, adaptation of the maximum 52-hour work week, and increment of family refusal due to negative SNS contents were turned out as main causes. It was very clear that public awareness and attitude plays a critical role which can be monitored by the donor card holder rate. Either campaign or legislation of first-person authorization will not affect the organ donation rate with any negative attitude of the public. To improve public awareness, the second week of September was dedicated to the National Life Sharing Week. The Korean Society of Transplant also has been performing various activities to promote public awareness through an NGO named Vitalink and NGO network called Korean Organ Donation Network, KODONET. However, the organ donor registration rate was only 4% among adult population. The population attitude survey by CDC showed that two main reasons for the low donor card registration rate of hesitation to register with vague causes and do not know how to register, and two main reasons for unwillingness of body damage or mutilation and vague fear for the actual organ procurement process. In Korea, more than 30 NGOs have been promoting disease organ donation, even using different kinds of donor cards, with contents lacking in consistency and most commonly through low-impact one-time campaigns. As a result, up to 93% of the general population has heard about disease organ donation, however, does not have enough knowledge to the level of understanding. This level of understanding only can be achieved by systematic education, not by publicizing using events. For the next target of expanding public awareness, followed by medical staffs and donor families, high and middle school students and medical students were selected. For the public education program, on and offline based organ donation teaching aids libraries were constructed using diverse approaching tools such as YouTube VitalLink Academy channel. First, Youth Education Manual was developed and published for middle and high school students. After communicating with school teachers about this program at school, this school education program was implemented. As a result, we could receive amazing feedback responses from many students, such as life sharing, I wanted to do it once before I die. I discovered that organ donation could save many people. Encouraged by high and middle school education results, we developed a pre and medical school education program. Before the class, a survey poll was done by Next Research Company, a company specialized in public opinion polls. 36 main questionnaires were generated to evaluate knowledge, attitude, and PR effects. Then, the students were divided into groups and studied using provided self-study materials. And each group was asked to present a poster on one of the 3 assigned topics, such as what is brain death and deceased donor organ transplantation. Among those submitted papers, we selected 1 best posters from every 3 topics. And 3 selected study group leaders have prepared their pre-recorded presentation for 5 to 10 minutes. The main lecture lasted for 1 hour and a half with these listed contents. After finishing the lecture, the post-education survey was performed using a list of 15 questionnaires. When this education tool was applied to the first grade pre-medical students of Seoul National University, we could see a huge improvement in their attitude and knowledge. The last mission of National Transplantation Registry is based on its usefulness for understanding the current status and the trend in transplantation, detecting risk factors which has negative impact, and promoting research such as biomarker studies and other clinical researches. To establish the National Korean Transplantation Registry, we visited and studied leading global organ transplantation registries. And with the help of global leader registries, we could establish Curie, the Korean Organ Transplantation Registry. Since Connors wished to run a very simple registry for the government's needs, Curie was designed as a cohort aiming for promoting research in transplantation. Curie is mounted on on-time visualization program and a biobank which can collecting and storing samples within 24 hours. The Curie provided a basis for another transplantation database, Abstract. Abstract is a platform for the Asian transplantation data supported by the Asian Society of Transplantation. The abstract consisted of 3 different database platforms: Abstract N for nation, Abstract H for hospitals, and a platform for linked database analysis for existing national registries. In summary, under the basis of WHO requirement, which was provided during the 3rd Global Consultation on Organ Transplantation of Madrid 2010, our governmental and hospital structures and organizations were established with modification of adding 2 fields: public awareness and coordination and policy fields. The current status of Korean system can be presented by this slide. The role of government has been critical for developing a national organ transplantation system, especially in legislation of the organ transplantation law, establishing a national transplantation organization, establishing a national independent organ procurement organization, and in legislating and implementing mandatory reporting law. The role of government has been also important in promoting public awareness by opening My Family Should Know My Wish campaign, legislation of first-person authorization law, developing education programs especially for high-priority target populations, and establishing and running the National Transplantation Registry. With that, I would like to close my talk. Thank you very much, everyone, for listening, and I would like to thank organizers of TTS for inviting me to present today. Thank you.